Hi, I'm Ursula Phoenix Ware with the Centers for Disease Control and Prevention. I'm here today with Dr. Henry Walk, Incident Manager for CDC's response to COVID-19. Welcome, Dr. Walk. Thank you for joining us this afternoon.
And thank you, Ursula. It's a pleasure to be here.
Wonderful. Well, let's go ahead and get started. Dr. Walk, as you know, this pandemic has been going on for quite a while, and people have been taking measures to protect themselves and stay safe for a very long time. What can you say to everyone out there to help them better understand how they can continue to protect themselves against COVID-19?
Yeah, thanks for the question. Now is really the time to be vigilant. As the cold weather comes in and cases are rising across our country, and we see hospital admissions are rising as well, now's the time to be vigilant. We have to be careful in our interactions with other people. We need to wear a mask. We need to watch our distance, and we need to wash our hands.
Wonderful. So what are some of the most important ways that I and the viewers can do to protect ourselves against COVID-19?
Yeah, again, the virus is spread through droplets through from our mouth and from our nose, and so one of the most effective ways to prevent transmission or infecting others is to wear a mask. Just a very simple cloth mask that goes over your ears can really stop transmission. It collects those large droplets. And the most important piece to remember is that people aren't always symptomatic. They don't have symptoms sometimes when they're infected. And so this mask can prevent spread of the virus from those who not only who are symptomatic, but also those who don't have any symptoms at all and are just walking around our society, potentially infected, and could spread. So we need to wear a mask when we're out in public, outside of our households. We also need to watch our distance. So this would be maintaining at least 6 feet between people. Wear a mask, watch your distance, and then wash your hands. Wash your hands for at least 20 seconds at a time. So those are the 3 W's. We also want people to avoid large gatherings. This is also an event, for example, where we could see a lot of spread. People come together, 20, 30 people together, not from the same households. This is where transmission can easily spread. So wear a mask, watch your distance, and wash your hands, and avoid large gatherings.
So on the subject of masks, and I have my mask here with me today, one of the questions that we get pretty regularly on social media is, do I really need to wear a mask?
Well, the simple answer is yes. And not only wear a mask, but wear it appropriately. You know, we see people, and you walk around in our society, you'll see people wearing it on their chin, wearing it on their mouth, wearing it with their nose uncovered. And again, these droplets, these respiratory droplets or particles, are spread from our mouth and from our nose. So we need to actually cover both to be effective. So, and the mask is really protecting others. So again, I could be infected and have no symptoms at all. And by wearing a mask in public, I'm protecting others from becoming infected. So yes.
Absolutely. Dr. Walk, we also get a lot of questions about testing. Can you talk more about testing and where I can go about getting testing completed?
Yes. So if you have symptoms of COVID-19, and that would include fever, headache, a runny nose, a cough, then you should be tested. Those that have a close contact, within 6 feet for a total of more than 15 minutes, to a case, a person who has confirmed COVID-19, those people should be tested. So if you have symptoms, you should be tested. If you're a close contact of someone who is a confirmed case, they should be tested, as well as your state and local health department may recommend certain populations to be tested. For example, those on college campuses or potentially those in particular workplaces. Where to be tested is a separate question. So there's testing in these these community testing sites, for example, the easiest way to be tested is actually to call your healthcare provider.
Okay.
See your healthcare provider, describe your symptoms, and then they can help you arrange a test, either at their office or actually at a community healthcare center, a federally qualified healthcare center, or a community testing site. So multiple options to be tested. So please, any symptoms, close contact with someone who's a confirmed case, or if your state or local health department asks you to be tested, there's a lot of options for testing.
All right, good deal. Earlier in our chat, you mentioned travel. With the winter holidays approaching, is it safe to travel to see family and friends?
Well, unfortunately, the short answer to that question is you shouldn't travel unless you have to. It's more essential travel. So I think I would say stay home if you can, and that will limit your risk. If you must travel for whatever reasons, and people have different reasons that they need to travel, then wear a mask and wash your hands and watch your distance. The concern about travel is whether you're in an airport or a bus terminal, a train terminal, people are in line. They tend to bunch up, and they can't maintain their distance as well. And so if you must travel, then be careful. Do the 3 W's. Wear a mask, watch your distance, wash your hands, and avoid crowding and clumping together in those terminal hubs, those hubs where a lot of where people are gathering to get onto an airplane or get onto a train. So avoid travel if you can, and if you must, then please wear a mask and watch your distance and wash your hands.
So we touched on this a little bit earlier, but let's talk a little more about this. What can people do to safely spend time with their families during the holiday season?
Yeah, so as the holidays approach, cold weather is also approaching, and people tend to congregate inside. So outdoors is better than indoors. And so if you have gatherings, friends and neighbors and families, it's best to have this outdoors, appropriately distanced with masks. So outdoors better than indoors. If you're indoors, then lower the number of people in a room so you can appropriately distance. Open a window if that's possible. Put a fan in the window to increase ventilation, pulling the air out of the room. And then wear a mask, wash your hands, watch your distance. So the 3 W's and avoiding those sort of large clumping of people, high density of people together is what we could do. I encourage people to put their coats on and talk outside if they can.
All very important. One final question, Dr. Walk. What would you tell a friend or family member to do to avoid COVID-19?
Similar things, and I'll just hesitate to repeat myself again, the 3 W's for certain, and avoiding crowds, but also to maintain vigilance. We're all tired. We're fatigued. We're months into the pandemic. And so people tend to let down their guard, let down their mask. And now's not the time to do that. Again, we're seeing the cases go up. We're seeing hospital admissions go up. And so I tell my family and friends you can have interactions with your friends. You can have interactions with families, but there's ways to do it safely. So I know it's hard, and I know that there may be many more months of this to come because we'll have vaccine, but we won't have vaccine for everyone. And so we'll still have to maintain these measures we've been talking about: washing your hands, watching your distance, and wearing a mask, and avoiding large gatherings. But this works. We've seen it work in multiple places, in multiple counties, in multiple cities around the nation. So if we can maintain our vigilance and we can maintain our social networks at an appropriate distance, we'll get through this together.
All right, good deal. Well, thank you, Dr. Walk. This has been a pleasure. We appreciate all the information that you've provided for us this afternoon.
Great, thank you.
And thank you all for watching. You heard from our expert. you can slow the spread of COVID-19 by wearing a mask consistently and correctly, staying at least 6 feet apart, and washing your hands often for at least 20 seconds. Be sure to stay updated on the latest COVID-19 information by visiting cdc.gov/coronavirus. Stay safe and healthy.